Hello everyone. Let's know the importance of HbA1c, which every doctor, and we ask you whenever you come to and tell us your fasting postprandial reports of your sugars. The next question is, what is your HbA1c? And I think most of us and most of you know now what is the importance, but let's have a quick kind of understanding. HbA1c is called as glycated hemoglobin. It is a test of your blood sugar level. Your average blood sugar of last 2 to 3 months is reflected in your HbA1c. What is the importance? Whenever the glucose rises in the blood, it gets attached to the hemoglobin molecule in the red blood cells. The red blood cell lifespan is 2 to 3 months. So the average glucose, excess glucose which your blood is carrying, gets attached to the red blood cell hemoglobin, and we can measure it by testing your hemoglobin A1c. So we know how much is excess sugar in your blood. What should be ideally HbA1c? It is 7%. There was a study done UK-PDS which actually showed that higher the A1c above 7%, higher will be your chances of having a complication. Like any person with diabetes can get an eye problem, foot problem, kidney problem, cardiac problems, heart failure. So every 1% rise in HbA1c above 7%, a risk of having all these complications increases. To keep your fasting postprandial glucose under control, your A1c should be also below 7% all throughout life. Right at diagnosis, you can push it down to 6.5 and keep it between 6.5 up to 7, which is good. In some situations, we allow a slightly more than 7%, which your doctor will definitely tell you. Now, any laboratory which uses standardized methods, HbA1c is very important. For research, it is a technique. There are some standardized methods. You should know which lab is doing what method for A1c. We do A1c 3 months according to definition, but even if we do every month, it shows some kind of a decrease, and it is easier for the doctor to manage or design your prescription, how your A1c is responding to your whatever treatment is given. So sometimes we ask A1c to be done maybe once a month, ideally every 3 months. A person can see a doctor after 1 year if you have all 4 A1cs in a year, which are very good. So checking A1c is your responsibility along with your glucose, and you should always remember what was my A1c in the past and what is now. I want to aim it for a better HbA1c. You don't need fasting to check HbA1c. Any type of random sample, any time of the day, we can give this sample and it gives our A1c report. Also, A1c reflects